Okay, guys, in this lesson, we're going to talk about paranoid disorders. So clients with paranoia and paranoid disorders have delusions and irrationality that's usually related to anxiety and fear, and it's characterized by suspicion and mistrust and an inability to rationalize with reality. So essentially, they find it very difficult to trust others. They're highly suspicious of those around them, but to others, they appear to just be hostile or disturbed and defensive because their paranoia doesn't seem to be based in reality or any kind of rational thought. Now, this includes paranoid schizophrenia, paranoid personality disorder, and just paranoia on its own. So some defining characteristics of paranoid disorders are when clients highly value being right and refuse to admit if they're wrong, or possibly can't even see that they're wrong, and they're very critical of others. They'll be very sensitive, they'll be hyper vigilant, and they may even resort to violence when their anxiety level is too high, or that fear, or if someone challenges them. Again, they're very anxious and they're very suspicious of others, and they tend to distort reality. Now, there's a difference here between distorting reality, which might kind of look funny if this is reality, and breaking out of reality. They don't necessarily break from reality, but they do distort it. So some things might be based in some aspects of reality, but for the most part, they have this hyper suspicion of those going on around them. So many of these clients will also experience something called attribution bias. So this is when something happens that most people would see as a coincidence or an accident, but these clients are absolutely convinced that it was intentional. So again, this is where things are based somewhat in reality. So let's say that you told them you were going to bring them a glass of water and you literally just forgot because you got busy. They are going to be convinced that you did it intentionally, that you're trying to, deprive them of water and you're trying to harm them. Okay. So as you can imagine, being super critical of others, being hyper vigilant, being super suspicious, and having this attribution bias where you're convinced that everything everyone does is intentionally trying to harm you makes it very difficult to develop strong interpersonal relationships, which can be very frustrating for these clients and their family members or their loved ones. So just a couple of important points. I do want to remind you about delusions. Delusions are false beliefs that are firmly held to be true despite rational argument. They are very real to the patient, but they are not real. Now, a lot of times these become a bit of a security blanket. Again, these things are based in anxiety and fear. So the more that the client will trust you and their healthcare team, the less they need the delusions to help them cope. Okay. Now, when we talk about paranoia on its own, separate from paranoid schizophrenia or paranoid personality disorder, it looks a little different. With isolated paranoia, the delusions are very organized and they're almost always based in some aspect or some sort of reality. Now, usually before this onset of paranoia, we'll notice that the client might be very quiet or very sensitive, and then suddenly they develop this paranoid delusion. And sometimes it's that attribution bias is what initiates this paranoia, where something happens and they make the assumption that it was intentional, and it triggers this paranoia. As far as interventions, remember that safety is our number one priority. And I know we've said this before, that some of these lists are long of these interventions because of safety being a concern. And that's very true here. Remember that those with paranoid disorders have a tendency towards violence when they're challenged or when they feel like they're cornered. So be very, very conscious and mindful of your actions around them. Never, ever whisper near or around a client with paranoia of any kind. Even if all you're whispering about is what to get for lunch, they are not going to see it that way. Also, avoid any physical touch without permission. Now, as with other mental health disorders, we want to decrease stimuli. So maybe take them out of a group setting, take them away from the group room. And then we want to start small and progress. So start with small tasks, progress to more complex tasks. We also want to establish rapport and trust. As always, be honest and genuine in all of our interactions with them. And don't make any promises that you can't keep. Okay. So remember, we talked about bringing that glass of water. So they are going to hold you to that. All right. So don't make any promises that you can't keep. We also don't want to play any competitive activities with a client with paranoid disorders, because if they were to lose the game, even if it was fair and square, there's a tendency with the attribution bias to feel like everyone's out to get them, or that it was intentionally, meant to make them fail. No matter what, we don't argue. we don't challenge, and we only ever reinforce things that are based in reality. So this might mean that you need to remove yourself from a situation and set boundaries. Okay. That's okay. We always want to make sure we're staying safe. So priority nursing concepts for a patient with paranoid disorders are safety, coping, and mood affect. Always maintain that safe environment, even if it means removing yourself from it. So quick recap, paranoid disorders are characterized by delusions and irrationality that are usually based in fear and anxiety. These clients are suspicious of everyone, and this paranoia becomes a bit of a coping mechanism. Make sure that we always stay in reality. Don't argue with them, don't challenge, only reinforce things that are based in reality. And then be very mindful of how you're communicating with them, including your tone, as well as the things that you say. And remember, no whispering or touching without permission. And then again, this is all about safety first for you as well as the client. So make sure that you do a self-harm assessment and always avoid any kind of perception of confrontation. Remember that perception is everything in these cases. Okay, so that's it for paranoid disorders. Make sure you check out all the resources attached to this lesson to learn more. Now go out and be your best self today. And as always, happy nursing.